5 Bad Foods to Eat as A Prediabetes Patients. Prediabetes is a common medical condition in human, which involves the blood sugar increasing chronically, but not so high to be classified as full-blown diabetes. However, this condition comes with similar health risk, which can lead to full-blown diabetes if not properly managed. When you find out that you are pre-diabetic, you will need to work on your condition, and also monitor your blood sugar level to ensure it doesn't go above its current level. You also need to take regular dose of insulin when needed. At that point, your body will be exposed to greater risk of having heart-related disease, kidney-related, and also pancreas-related diseases. The lifespan for a diabetic patient tends to be 10 or more years shorter than the average. It's important you make changes to your lifestyle. If you have been confirmed to have prediabetes, in order to effectively combat prediabetics, it's very important you start monitoring what you eat, and also eat like you already have diabetes. This involves consuming foods low on sugar, and high on other essential minerals. The following is a list of 5 worst foods you should be eating, if you are diagnosed of prediabetes. 1. Sugary foods. If you understand diabetes properly, then you should know why we have sugar as the first on the list. But in case you don't, it's best to explain to you that diabetes is caused by the inability of the body insulin to process the excess sugar present in the bloodstream to energy. Diabetic and pre-diabetic patients must be very cautious about further consumption of sugar, to avoid increase in the glucose level present in the blood. Nevertheless, it's highly recommended to take fruits, rather than consume foods filled with processed sugar. 2. Fruit juice. For a diabetic and pre-diabetic patient, fruits seems to be the best option. But it's not wise to take it in form of processed fruit juice. This is because, juice contains all the sugar present in fruit without the fiber content. The sugar present in juice is far more concentrated than what you get from the fruit directly. However, to continue enjoying fruit flavors without increasing the sugar, try using clean water with little juice added. 3. White rice, bread, and flour. Rice is another common source of glucose sugar from carbohydrate. It's very important to avoid food like rice, white bread, and pasta, if you are diabetic or pre-diabetic. Instead, you can look out for whole grains like that of the brown or wild rice, and also whole grain bread and other pastas. 4. Fat dairy products. A diabetic patient has a higher risk of having other additional diseases, such as those related to heart and cardiovascular disease. An increased level of cholesterol also possess a high risk of having heart disease, and also worsens the damages carried out by diabetes. Research have shown that foods high in fat can easily frustrate insulin resistance, which will make it tougher to reverse the diabetes. It's highly recommended that you avoid eating full-fat dairy products like that of cream, cheese, yogurt and ice cream. 5. Fried foods. Another bad foods to consider as a diabetes or pre-diabetes patient are fried foods. This is because fried foods are problematic, and are well loaded with lots of calories. Different kinds of fried foods alter your body sugar level differently. For example, French fries will easily increase your blood sugar level more than fried chicken, because potatoes contain majorly carbohydrates, while chicken contains majorly proteins. However, we are more concerned about the preparation of these products. These foods can be healthy when not fried, but when fried, the additional fat content usually slows down the sugar absorption in the body,